Hi guys, Dr. Earl here with the Performance Health Institute at the FCA National. Just going over some common rehabilitation approaches and some corrective exercises that are commonly used up in my practice, up in the Chicagoland area. I work at 2 schools and I try to integrate CLX bands pretty regularly with my patient population. So we're going to go ahead and get started with some intra-abdominal breathing and bracing with utilizing the CLX bands. So come on over onto the table here, Nacho. You'll lay on your back and we'll start here like so. We're going to go right into the halfway point of the band here and go ahead and bring your legs up to the 90-90 position. There you go. So we're going to start here like this. We're going to crisscross and then the arms are going to go, so right arm's going to go in here, slide the hand through the nice CLX loop here. Yeah, just like that. And this arm's going to come underneath. Slide that in. Very good. So the hands are going to go up to like here. And the legs are going to come up here. Just like if we were to take him and we were to put him into a vertical position, this would be a squat pattern here. So bring your arms like so. There you go. The knees are going to come up like this. There you go. And just to start, what we could do is just differentiate extremity motion from spinal motion. So he's going to try to maintain a good chest position, a good lumbar spine control. No wandering of the legs just yet. He's going to hold here, and he's going to take, it's easier with the band that's on the bottom, and he's going to try to just move the left arm here. So just take this, try to go all the way overhead, and come on back down. And we're going to try to make sure that he keeps the rib cage in a good position right here, and reach one more time with the left, and come on back. There you go. And what I also want you to do is try to take the legs even wider against the band. There you go, and bring the heels in a little closer. Just like that. Go one more time with the left. Try not to let the rib cage wander. There you go. And come on back. Now let's try the right arm. Take the right arm up overhead. There you go. And back down. Let's rep that out. Let's do 3 of them, keeping this rib cage down. Very nice. Good. Now you can mix and match and be as creative as you want. So we'll go left arm. And let's keep the left leg here. Let's do like an opposite pattern here. Keep the left leg there. And we're going to extend this leg all the way down. There you go, so we get this X pattern here. That looks really good. Now come on back. Always start at this this pattern right here. There you go. Now do the right arm, left leg, trying to keep that there. And if they feel like they maybe need a little bit more resistance, sometimes I add a little manual resistance here. So for example, I'd go like this. Don't let me push you, don't let me. Come on, tighter. There you go, like that. Good, and relax. Good. And drop the heels. Good. So that's the first one, just kind of incorporating good spinal stability, good control of the abdominal wall, while at the same time working some of these X patterns, these PNF X patterns here. So now we're going to work on some of these very common. The next one we're going to use is Glute Bridge. So he's going to be here like so. He's going to keep the hands right here, kind of together. He's going to bridge up. He's going to keep the rib cage down. He's going to bridge up like so. Again, he's going to try to extend. He's going to try to A-B duct, try to get these glutes going just a little bit. And then he's going to try to take his hands overhead together. Again, not letting the rib cage. Good, and come on back. So stop right there. We can work one arm, so you could go into like a single arm fashion like this, and then back up. And now take the right arm out. It might get a little caught, but there you go. And then back. Good, and go one more time. Keep the trunk up, that's good. And go overhead like so. There you go. You're sweating, man. Good, hold that there. Again, I can always add a little overpressure here. Relax now, I'll give you a little bit of a breather. Now one of the modifications that I like to add to this is to go onto a single leg. So he's going to come up into the bridge. His hands are going to go straight up like this. Come on into the bridge. Now he's going to just extend the leg here so it's parallel with the opposite femur. And the goal is to try not to rotate the trunk down, but he's going to keep it like so. Hold that for about 10. Sometimes you can add a little resistance here, like that. Good. Get that whole anterior chain going. Good, and relax this leg down. And do the same thing, keep this good supporting right here, and then hold right there. Should be able to hold for about 10 seconds each side, making sure they don't cramp in the hamstring or anything like that. And then let's add some resistance here. Good. And for the sake of it, let's just have you reach this left arm. Keep that leg there, and reach the left arm out to the side, and then back. And now take the right arm out. There you go. Good, and come on back down. Perfect. Now what I want you to do, you can totally relax there, Nacho. Now we'll take this out because we're going to flip over. So let's go, yeah, so it's easier if you almost get into the position here. Go, come up into quadruped. There you go. We're gonna slide. We're still gonna crisscross the hands here. There you go. I got this here. Just, there we go. So slide the hand through there like that. So this is Quadruped Edge. It's a very common spine sparing exercise. You could do prone rocking, leave the hands right there, try to rock all the way back. Then you could reach this, so stay right there. You could reach up, trying just to move through the arm, and come on down. That's just one of the many variations of this position, but what I want to show you is the next progression to this, which is he's going to curl the toes here, like so, and he's going to almost look between his elbows, and his hips are going to come up higher than his shoulders. So they're going to come, knees are going to come up off the table. There you go. Keep coming all the way up, all the way up, all the way up, just like that. Bend the knees for me. There you go. Keep that spine nice and neutral right here. Drop this. There you go. Really good for shoulder and for good glute, good core control right here. Really good. How are the hands? Okay. Good. It's a little soft right here, so sometimes it can be done easily on the floor. You can use this as kind of like a functional test. You can see what's going on in like the lumbar spine and the control of the pelvis. Let's have you pick the right leg up 1 inch. There you go. Hold that right there. Keep the head up nice and tall, chin down, right there. Good, shoulders back, really good. Right foot down, left foot up. Try to keep this leg out here. Really good. That's tough, isn't it? Yeah. It's a tough one. Give yourself a breather. There you go. So now what we just did was the lower body. Now we're gonna do one for the upper body. So you're gonna come up, you're just gonna pick up one hand, 1 inch off the floor, and then you're gonna put it down. But the trunk is gonna come up. So let's come back up into that starting position. Knees are gonna be out wider. There you go. Now, supporting on one side, let's lift the right arm up 1 inch. There we go, hold that there. And then down. Now take the left hand up 1 inch and down. The next progression from this would be if you could do opposite arm, opposite leg. If you can, let's give that one a try. It's pretty hard, and down. That was one of the most challenging ones that I would give a patient. That'd be very elite or very advanced progression for this. So drop down to the knees for me, back to quadruped. If they can't do that, then we'll just go back to quadruped where you're here, you're reaching out, and then taking the left leg into extension, trying to keep that nice and stiff. There you go. All the way back into extension. There you go. And relax. So those are some of the common exercises that I would give for full body stabilization and good activation of the trunk and the pelvis using the CLX bands. So thank you so much.